The mature athlete always has to be careful with what kind of activity they dive into. I'm talking about 70 and 80. And I do have patients that are 70 and 80 that still do mostly walking or body weight exercises, but it's fantastic because when they don't exercise, it's almost the same reaction as a middle-aged athlete or young athlete. They don't feel right. There's something that's missing when that exercise activity is not in the mix or in the schedule. And so there is caution to play as you get older. Just because you worry, I worry as the physician about balance, about eyesight, about tactile response or proprioceptive speed. And if that happens, I have to worry about a fall. So especially in Chicago, it is important to consider a physical therapist evaluation first, or just a doctor evaluation to make sure that the checkup says that we're safe. If we're not safe, then it's always worth the investment of seeing a physical therapist in it's called a prehabilitation program. It's kind of like getting somebody, aside from a doctor, getting somebody to take 1 or 2 hours and assess your strength level, assess what I mentioned before as far as proprioception, that means balance, and assess what you're doing as far as your gait. They'll put you on a treadmill and they'll watch you with your regular walking shoes or running shoes and see if there's any imbalances that have to be corrected. And even if you're used to walking kind of funny, as you continue on or increase your activity, sometimes standard things that you're used to can turn into problems later on with either a low back issue, a worsening of arthritis to one or both knees or your hips. So just be careful. Ask your doc, for maybe a physical therapy prehabilitation visit, or you can always see an orthopedic specialist for that too. And then comes the idea about, well, how aggressive do we get? One of my teachers, Andy Weil, has always said, when it comes to exercise, you should act your age. And I think there's a lot of validity to that. You just have to, now I guess in the United States, 40s, 50s, and 60s, acting your age, nobody really, the majority of Americans don't do much. And I think there's a lot that we're missing. So you don't have to necessarily go into bodybuilding again. You don't have to necessarily go into a half marathon or a marathon to get active. It might just be something as easy as hiking, something as easy as taking a walking program, or getting the old resistance exercises back into play. Now, bodyweight exercises are very easy to do. You don't have to have a big membership to do them. This is a 40-pound weight vest that I sometimes will put on when I'm seeing patients for a couple, 6 to 8 hours. And it does add some resistance. It's not much. I usually carry about a 30 to 40-pound backpack when I go hiking or take my groups hiking. I'm the guy who carries the nutrition or the hydration stuff, but I consider it a privilege to get the resistance exercise out. But when you're starting out, you have to be safe with what you're doing, you have to be wise with what you're doing, because if you go 110% out of the gates and on your first or second day your brain says you can do it but your muscles say nope, now you're going to pay for it. That's when, like in the previous slide, that episode of delayed onset muscle soreness will really rob you of a couple of days to up to a week of pain, and then it becomes a negative feedback or a bad experience that gets burned into the mind. So this has to be done gracefully, slowly, and safely. If you're not sure what to do, that's the objective of getting a coach, is to empower you with the least amount of suffering, the fastest amount of improvement in a short duration of time. The time period I'm talking about can be as easy as setting the 12 weeks to change. And I think that when you hit that 12 weeks, it usually gives you a sense of accomplishment. It's not too far off in the distance that it's intangible, and also sets you up in at least Chicago for the next season that you can take advantage of. Hiking season's coming up. When springtime comes, it's still a little chilly outside, but there's no bugs. The grass is starting to build up again, so you see trails, you see off trails in some cases, and the weather is not too bad, so you don't have to worry about dehydration too much. But it'll train you when you're in Chicago to get out into our national parks in other states and then really have a great time and make that summit that you're trying to train for.